Welcome to Trendy Flicks, your ultimate destination for the latest in movies, TV shows, and streaming trends. Subscribe now and stay ahead of the entertainment curve. Trump puts Biden on defense for Medicare Advantage cuts. Seniors are expected to face $33 in out-of-pocket expenses each month after Medicare Advantage cuts. Medicare benefits have emerged as an election hot topic, putting President Biden in a likely precarious situation with senior voters after slashing the popular Medicare Advantage program's benefits ahead of the election. "I will not cut one penny from Social Security or Medicare, which Joe Biden is destroying by letting millions of people come into our country. He's destroying Medicare and Social Security," Trump said during his rally on Temple University's campus in Philadelphia last weekend, setting the stage for ongoing attacks against his 2024 competitor. Joe Biden has cut Medicare Advantage for the last 2 years. Did you know that? He's cut your Medicare Advantage, which is a total betrayal of seniors. And just check, you'll see it. He has cut you down for 2 years straight. Medicare was cited again during the first presidential debate of the election cycle on Thursday, where Biden's disastrous performance included him saying, "We finally beat Medicare," as he stumbled over his words. He's right, he did beat Medicare, beat it to death, Trump fired back. And he's destroying Medicare because of all these people are coming in. They're putting them on Medicare, they're putting them on Social Security. Medicare Advantage and May plans, specifically, are private health insurance plans that contract with Medicare and are used by more than 33 million Americans. The program mostly enrolls adults over the age of 65, but also offers benefits to people of all ages with disabilities. Traditional Medicare, conversely, is a federal health insurance program for adults over the age of 65, as well as younger individuals with disabilities. The Biden administration in April finalized plans to cut MA benefits, which experts said could lead to an additional $33 a month for out-of-pocket costs, or $396 a year for enrollees. Critics of the cuts said they would be especially devastating to seniors living on fixed incomes who are already coping with ongoing inflation issues. Fox News Digital spoke to a former nurse, Republican New York Congresswoman, and Consumer Product Safety Commission Chairwoman Anne Marie Buerkle, who said the cuts could prove devastating for the Biden administration as the 46th president hits this election cycle's fever pitch. By letting far-left socialists control his policy agenda, Biden made a huge blunder that will jeopardize his support from the 33 million Americans enrolled in Medicare Advantage plans who will see their premiums go up, copays increase, and benefits decline before November, said Buerkle. The cuts come as the left-wing faction of Congress continues promoting Medicare for All legislation, which would establish a universal single-payer national health insurance system. Buerkle said the Biden administration's cuts this year actively sabotage MA, likely in a backdoor attempt to promote a government-focused system, such as Medicare for All. Far-left ideologues like Elizabeth Warren hate Medicare Advantage's success as a public-private partnership because it undermines their argument for government-run healthcare, aka Medicare for All. Biden has let these far-left ideologues in his administration actively sabotage MA so they can prop up a government-run model and achieve their socialist agenda, she said. The sentiment was echoed in an op-ed published by Fox News Digital in May by Heritage Action Executive Vice President Ryan Walker. Biden and his allies want to cut MA in favor of more government-run, fee-for-service Medicare for All, which would mean fewer options for physicians and coverage, like vision and hearing. Recently, progressive ringleader Rep. Pramila Jayapal, D-Wash, and a coalition of 59 far-left House Democrats sent a letter to Biden arguing for strengthening traditional Medicare and redirecting funds incorrectly going to MA, Walker wrote. The Biden administration pushed back that any claim that this administration is cutting Medicare is categorically false and disinformation, adding that protecting Medicare is a key priority for President